So, ladies and gentlemen, chairman, scientific directors, first of all, I'd like to thank you for inviting me to this beautiful town, to this important meeting. They gave me a very specific topic, the influence of monocryl supplementation in the biocompatibility of a polypropylene mesh repair. Does it impact groin pain? Very specific and very, I think, boring topic, but having a look at this flyer you all have, you probably will know why I had to talk about this special topic. So, having a look at the literature, unfortunately there's no single study investigating the impact of monocryl supplementation in the biocompatibility and its effect on groin pain. So, I could stop my lecture right now because we actually do not know if there's an impact or not. But I will come to this later on. First of all, and you already heard about it, the main subject of our thinking considering the outcome of inguinal hernia repair shifted from the recurrence and the recurrence rates, which recently has been published by Professor Kellett, to the chronic pain. And he distinguished between the patient-related factors and the surgery-related factors. I actually do not believe that we have this recurrence rate absolutely optimized right now, but okay, we are going to talk about the chronic pain right now. And these are just a few samples of our surgery-related factors. Are we operating open or laparoscopically? How do we handle the nerves? How do we fix the nerve? And Professor Campanelli will tell us about this item later on. And last but not least, what about the kind of the mesh we use? So, and I'd like to focus a bit on the last part of this. And these are just two samples which we explanted in patients who had chronic pain. On the left side, you can see an histological picture, and you can you have this pointer for me? I can do it by myself. You can see these holes in this figure. These are the mesh filaments, and in this special immunohistological staining, these are identifiable nerves. And this is the so-called foreign body reaction induced by the mesh, and which is infiltrating these nerve filaments, which are so small that you never can see or handle or fix or not within the operation. On the other side, you can see such an explant, which is a huge stiff scar plate, a mesh which was implanted 2 years before in the inguinal area, and you can imagine that both of these patients had some kind of pain. So, why is it as it is? And both examples you saw, the reason for these patients is that every implant you use, it induces a kind of foreign body reaction. Directly within the operation, there are cytokines, growth factors released by the human body trying to eliminate this foreign body. But unfortunately, because all of us take some kind of polypropylene meshes, the human body is not able to eliminate this foreign body. And therefore, the human body is trying to eliminate or encapsulate this foreign body, leading to a chronic inflammatory and afterwards a chronic connective tissue formation. So the hypothesis of our thinking about the different mesh materials was that we have to optimize mesh implants which are able to decrease the rate of clinical complications, especially the rate of chronic pain. So a possible solution would be we have to reduce the amount of mesh material to minimize the biologically active surface of our foreign body and therefore to minimize this foreign body reaction. So there are some textile characteristics the foreign body reaction belongs to. First of all, I told you the biologically active surface, which depends on the pore size of the mesh you use. Unfortunately, it's not working right. Oh, yeah. The pore size of the mesh you use, the weight of the mesh, and the kind of filament, using a monofilamentous or a multifilamentous mesh. It belongs to the polymer you use as well, but unfortunately, right now, we just have polypropylene meshes on the market. So, coming up to the weight, and this is just a small calculation. Taking a 10 to 50 centimeter mesh, which in its heavyweight modification has a weight of 100 grams per square meter compared to a low weight mesh with, for example, 33 grams per square meter. Calculating the overall amount of mesh using this 10 to 50 centimeter mesh, you just use 1.5 gram using this heavyweight mesh and just half a gram using this low weight mesh. So some of you would tell me, is it really of importance to have 1 or 2 gram of foreign body more or less within the inguinal area? But we have to keep in mind that this heavyweight mesh is constructed of 150 meters of a filament compared to the low weight mesh, which is constructed of just 50 meters. And calculating the overall biologically active surface, the lightweight mesh would have a biologically active surface which is like this piece of paper compared to the heavyweight mesh, which already has this kind of biologically active surface where the human body has to handle with.